what you were just talking about with food allergies and sensitivities. We're seeing more and more people with sensitivities to this, allergies to this, can't digest this, you know. So as practitioners, how do you incorporate food as medicine when they're coming in with sensitivities to food?
I usually try to explain to them that when they're encountering their food allergens, they're basically putting their body under attack. And it causes a lot of inflammation, and it can cause, a variety of symptoms from, joint pain, headaches, to behavioral issues, and of course, digestive upset. So I just try to, let them know and convince them that they're doing a favor for their body if they are able to avoid their allergenic foods, or some foods they're sensitive to, and do the repair work that's needed to fix their gut. Because a lot of people have pretty messed up guts from basically modern life.
If you guys haven't had a chance to try the raw milk that's out there, the owner of Organic Pastures, he's kind of like one of my, I just phone buddies, we've been talking and stuff like that. But sometimes you can be allergic to like dairy, but it's really the way they process the dairy that's the problem. It's not that you're allergic to dairy, because I'll give you one example. When you homogenize something, you actually have to, well, first, when you defat something, so when you take the fat out of milk, you have to process that. It's not easy to take fat out of something that normally has fat. So, you have to spin it really fast, the milk rises, they skim it, but now the milk loses texture. So what do they have to do now? They have to homogenize it. And that's why all the low-fat, 2%, whatever milk is not good for you. You have to drink it in its natural form. It came directly from nature again. What homogenizes means is 4,000 pounds per square inch. They force the milk through these tiny tubules or a metal plate that has tiny holes in it to get the consistency back. Otherwise, it doesn't have that good mouthfeel, and then people won't buy it. Now, why do the companies do that? Again, it's economics. Because you have the milk fat, but now you can make other products out of it, right? And when people have the 2% or the non-fat or the skim milk, they're going to drink a lot more milk. So you're making more money that way. Instead of somebody being content with a glass, they might need 2 or 3 to get full. So, so when you process the milk that much, then you might end up getting the food intolerances and stuff like that. Because by the way, real milk has almost as much probiotics as a yogurt would have. But, so that helps you digest all that lactose and all that stuff, because the bacteria chews on lactose, which lactose is sugar. So the bacteria eats the sugar. And that also would happen in our gut if we didn't kill it by all this pasteurization and homogenization and, all that stuff. So, and that's just one example of how whole foods, you wouldn't be necessarily allergic to it.
Yes, this is interesting because I myself and my kids show allergies when we come here. When we go to India, we don't get those allergies, food allergies, especially milk. They show, like my kids show allergies in the lab, and when they go to India, they don't have it. So that explains that. And I also wanted to talk about the Ayurvedic perspective on the allergies. How we look at it as Heidi said, is the food, like diet and lifestyle here, that contributes, and how we look at it is, in Ayurvedic perspective, there's a digestive fire, and it gets disturbed because of the wrong foods or wrong eating habits, and it develops toxins. And if you follow the notes, they would have, I gave you how it does that. And so there's that toxin accumulates in the intestines, then the chemicals acts on it, and then it enters the general circulation, and then it acts as an antigen in the channels and tissues and cells. And when we eat that particular food again, it creates more and more antibodies, and that creates allergies. So the main bottom line is improve your diet and lifestyle, and that would show it less, because in the developed countries it's more and more. eat natural organic food, they don't have it more. And I can prove it by my example. When we go to India, we don't react to food as much as how we react here because of the processed foods and everything.
I just have a quick question about the raw milk. There's so much out there about you can't eat this and you can't take that if you're pregnant. Could you drink raw milk if you're pregnant?
I'm not gonna make that call. I mean, I would say, the way he does it, because see, raw milk, if it's coming from diseased cows, that's when it causes some problems. But his cows, they're coming, from Northern California, outdoors, they're eating grass, you know what I mean? All grass diet, real grass, fresh, not hay and all that stuff. So, so I would say his is probably okay to do raw, but I wouldn't trust any raw product that you get out there, because, there could be some that you aren't sure about the quality, so.
Yeah.
Yeah.
Okay.
Can you boil it?
Yeah, you could boil it too, actually, then you would pasteurize it. But I mean, it's better than, what they do in the factory, that's for sure.
Absolutely.
Yeah.
Okay, thank you.
Okay, we're gonna go on to our next question. So, I'm not sure, do you play a role in kindergarten through 12 food programs? And if so, how, or what would you suggest?
Stephanie?
Everyone.
Oh.
Anyone.
I'm sorry, I don't.
Yeah, again, the answer is no, but I would really like to. I think we gotta get them early, and I think I heard or read, I forget where I saw it, but there's a prediction that by, is it 2020, that half of all children will be diabetic, which is really frightening. So, is it 50%? Yeah, sorry, I'm horrible with numbers, but yeah, I see. But yeah, so I would say, teach them early. Sugar is not a reward. And, sugar, a soda might not affect, us, 120, 40, 60-pound person, but, for a little 30, 40-pound rugrat, that's good. And, like I said before, sugar's like crack. So teach them early about good foods and good nutrition. And somebody was
I was just going to say, I used to teach at junior high school before I came and became a licensed acupuncturist. And it is amazing the things that kids eat. It's just crap. They come to school and after lunch, you can see them. They're just completely different. They're like zombies, or they're out of control. They're I've had all kinds of things. And they're trying in some places to change what kind of foods go into the school. But I think it's important to teach your children also, because a lot of the kids didn't really care about that sort of stuff. And I have a lot of friends who have young children, and I see them do things like, oh, good job, here, do you want some chocolate? Or, oh, you're fussy, here, have some cereal, with sugar on it. Right? They're giving treats for doing things, and they're giving treats with sugar and that to calm the child. Right? Or to occupy them on a car ride. Here's a bag of M&Ms. They're 2 years old.
Yeah, we're turning them into crack addicts.
Yeah, it is so much easier to give them a box of blueberries.
Exactly. I read, I think I hear about a study somewhere where they took this, a junior high school in Wisconsin, I believe it was.
I think it was,
and they took out, tell me if I'm telling this right, and they took out the vending machines. I don't know if they replaced them with something healthy, but they took them out, eliminated the candy and soda from the school. And can anybody guess how much they cut their discipline problems by? 90%. Not 10, not 20, not 50, 90%. So that just gives you a small window on the behavioral effects of sugar, otherwise known as crack.
Yeah.
So, I know this is a room with a lot of healers too, and a lot of people always want to do good things and do volunteering. And I'm a parent, and so every year I speak at my child's school about health and nutrition. And that's a wonderful opportunity for anybody to do, is to educate the children. I volunteer my time, and I go and I talk to a room full of children. I spoke to 70 first graders, and it was the second time they saw me, so they're like, oh, we remember you. And it's great, because you do start them early, and I talked about colorful foods and how important it was to eat different colors, and you make it exciting and fun for them to learn.